Welcome to the Infectious Diseases Fellowship at Orlando Health. I'm Dr. Antonio Crespo. We are located in Central Florida in Orlando, a rapidly growing, diverse, cosmopolitan, and vibrant community. We are the only infectious diseases fellowship in the area, and we are members of one of the largest infectious diseases groups in the region. Our group of 6 faculty attendings, along with our close allies in microbiology lab, infectious diseases, pharmacy, and infection prevention, we are ready to provide you with a well-rounded training that will prepare you to the practice of infectious diseases in any setting, such as a big academic center, a community hospital, an outpatient practice, taking care of patients with HIV, chronic viral hepatitis, among other infectious diseases, travel medicine, managing the ever-growing field of outpatient therapy, as well as getting you ready to be leaders in your hospitals and in the community in the growing challenges of emerging infectious diseases, antimicrobial stewardship, infection prevention, and quality improvement.
We want to provide you with a comprehensive curriculum for your formation and appropriate exposure to different and challenging cases. We have a dedicated surgical infectious diseases service to ensure that you will have the exposure to infectious complications after surgical procedures. You will be familiar with osteoarticular infections and infections complicating hardware and implantable devices, such as pacemakers, LVADs, and more recently, ECMO. Our ID group is involved in several aspects of direct patient care and other areas like antimicrobial stewardship and several committees aiming to decrease hospital-acquired infections. Our fellows are part of the Antimicrobial Stewardship Committee, which I currently preside, and they're involved in the conversation regarding hospital policy, which has an indirect impact in patient care. In sum, we want you to be ready to face the ever-changing challenges of an ID world.
You're going to be exposed to an environment and to varied pathology, given that we are a level 1 trauma center, so you're going to be seeing trauma patients with complex infectious diseases, neurosurgery patients, and other infections that you may see in places where there's a very diverse population, including patients from Central America, South America, and the rest of the world. My role as a faculty here has been involved in exposing our fellows and other faculty members to the array of complex infectious diseases that this population of cancer and transplant patients may present with. I have been involved in slowly helping to improve and optimize the management in the stem cell transplant unit that recently started, and I'm also very involved in trying to enrich the knowledge of fellows and faculty with lectures on infectious disease board review courses focused on cancer and transplant infectious diseases.
In our infectious disease program, we're looking for a candidate that's very enthusiastic about infectious disease, love what they do, and willing to learn. Our program boasts training in a wide variety of hospitals. We have Orlando Regional Medical Center, which is the only level 1 trauma center in the area that boasts very complex patients across a wide variety of specialties. We have Dr. Phillips Hospital near Universal Studios, and we also have a hospital like where I come from, Orlando Health South Seminole, which is a small community hospital. While you're doing your rotation there, you will learn how to be an infectious disease doctor in a small community setting, in a place where everybody knows your name. When you walk in the morning, everybody knows who you are. You go to the doctor's lounge for lunch, and all the different specialties are there, and you discuss all the different patients. For somebody who moved here only less than 10 years ago, this has been a great place for my family and I. We love living in the city. It has all the benefits of everything all the big cities can offer. It is a full, vibrant, diverse city with all kinds of people from all different backgrounds.
I actually have a unique situation that I also did my training here as well. I chose this program for my fellowship mainly due to its kind of in between a large academic center and a community hospital, as well as for the family aspect of a medium-sized city like Orlando with plenty of things to do in the community. So here at the Orlando Health Infectious Disease Fellowship Program, we try to provide a a wide range of training for our fellows so that when they leave, they become well-rounded infectious disease physicians and that they're able to work wherever they want to. And part of that training here in our fellowship is the pediatric infectious disease rotation. It's a 1-month rotation where you will rotate with 2 of our pediatric infectious disease physicians in the community. You get some more hands-on training with some of the immunodeficiencies as well as some of the other infectious diseases that may affect the pediatric population different. It's important rotation because when you leave, you may be in a small community that doesn't have a pediatric infectious disease physician, and you may be called upon to provide some basic infectious disease care for some of the pediatric patients.
One unique thing about our infectious disease program here is the fact that you will round in different hospitals. That will give you a great exposure and will enrich your experience as well. The other thing is we created this program with you in mind. You are the center of the program. Your learning and well-being is our #1 priority. One of the things that we can offer you in Orlando Health is an excellent HIV training. We are creating a HIV clinic specifically to service HIV patients and provide comprehensive care. You will be training in that site. We promise you, by the time you are done with your fellowship, you'll be able to have a complete understanding of HIV and you'll be very comfortable and will be able to provide outstanding care after you graduate.
A unique aspect of the ID Fellowship program here at Orlando Health is having those close relationships to the ID pharmacists. We actually have ID pharmacists and ID pharmacy representatives at all of our Orlando Health hospitals. And I believe it's a very unique aspect to our health system because the fellows have this direct connection to an interdisciplinary team that helps improve patient care and contribute to those discussions that are so importantly related to the pharmaceutical needs of the patient.
I will be your subject matter expert in microbiology diagnostic testing. There's a lot of available options for esoteric testing, and I consult with most of our infectious disease physicians on complicated cases. We always want to try to stay in network for our testing, and we're trying to build up our resources internally to better affect patient care. If we don't have it in-house, we will move to reference testing, and we can talk about the caveats that come with reference testing.
I chose this program because I knew of the reputation that Orlando Health has in the state. You know, it's one of the largest facilities in downtown Orlando. It offers multiple different specialty expertise not offered at other facilities. It's the hospital that, you know, patients are sent to from all the other smaller community hospitals around the city. And, you know, I knew that I would get the greatest exposure and the best learning experience here in downtown Orlando at Orlando Health ORMC.
I chose Orlando Health Infectious Disease Fellowship Program because the pathology and the learning opportunities as well as the energy that the attendings our program director provides to the program. When I interviewed, they made it very clear that they wanted the fellowship to be tailored to my interests and as well as to optimize the cases and the learning that we see. And it was a great place for me and my family. They were very excited about moving down here, and I'm very grateful for the opportunity that I've been given to be a fellow in this program.
We're at ORMC for trauma and for most of the, I would say, particularly complicated aspects that you would have taking care of people, including burn unit. So there's a lot of things that we get exposed to from an ID perspective that you may not have. We take transfers for all kinds of trauma. So really, from that perspective, I would say that's why we tend to get such good training, because yes, it's a world hub for tourism, and that's going to obviously contribute quite a bit, but it's also the fact that this is kind of the, if you're having trauma, if you're having X, Y, Z in Central Florida, this is where you're coming. If you think of something, you know, whether it's, you know, ruptured appendicitis, which is simple, to something more complex like neutropenic fever or meningitis, it's not just, you know, you'll see those anywhere, but it was the depth to which you would see them, how unusual or complicated that they were, you would get to see those. I feel like the program is preparing myself and anyone that may be in the program for the future, because they're able to carve out time to teach us in regards to what we are actually actively engaging and taking care of that day, as well as we're having lectures and a variety of aspects of care, maybe the ones that we're not seeing that day, but that we are seeing at some point, and so that way we get a leg up by the time we do see them. Or if we've already seen them, well, we're getting reinforcement, and that really helps in the future for us when we're on our own.
We know you have many options for your infectious diseases training. Thank you for considering us, for watching the video. We have a very comprehensive and competitive program, and we're waiting for you here.